The coronavirus pandemic has had a massive effect on global health and the way we live our lives. It's likely things won't get back to what we knew as normal for some time, if ever. Many companies have struggled, but some businesses have actually thrived during this period of uncertainty, either finding themselves able to help with existing products or adapting to the situation with inventive solutions. Share prices have soared as a result. We've spoken to four of these companies, all in some way using technology to fight the virus and get the economy up and running again. We asked the people running these companies how their business has altered as a result of the pandemic, how it's helping to ease the UK back out of lockdown, and whether this particular period of prosperity will outlast coronavirus.
We are a scientific and IP based business operating in the field of infection control and prevention, and we do that largely through biocides. And biocides are liquids and chemistries that eliminate viruses, bacteria, algae, and fungi from places where you really don't want them. In some cases, we kill them. We are operating in what we call health sectors, which is human healthcare and animal healthcare, but also healthy work environments, healthy human beings, health in general, and healthy environment. And we sell our products for a variety of product sale direct to customers, product via third parties into businesses and to consumers, but also technical development deals and licenses. Prior to Christmas, the business is already actually doing quite well. We were going to be profitable for the year to 31st March 2020. And we're doing quite well because we're positioned for a big structural change in the industry that was very much taking place. And that is biocides it's a massive market globally, many billions, but it's quite a fragmented market as well in terms of the industry participants. And in the last few years, governments and supranational regulators have realised that these markets need to be regulated because biocides used incorrectly can cause damage to the environment and also damage to human beings and animals. So they have now been approving chemistries used in our market, but also banning some. So what you have in our market space prior to Christmas was massive global demand growing at 3 to 5% per year. And then a supply shock taking place quite slowly where certain chemistries are disappearing. So you had fewer chemistries available for feeding that demand. And what COVID has done has actually brought instantly a big demand shock to the industry. With huge amounts of different types of demand against viruses and bacteria, particularly viruses. And you put the two things together, and business-wise, that's extremely propitious. And so from a position of expecting to be profitable to 31st March 2020, we're expecting to be substantially ahead of that this current financial year to 2021. Now, the question is, how long is the current situation going to endure and at what level? Our take is that some of the hype will disappear, of course, but actually the marketplace has changed massively in consumer behaviour, in business expectations, in legal situations. A whole variety of things mean that the market is going to be significantly larger than it was prior to Christmas. And I think people with our sort of positioning, which is aggressively scientific and aggressively ethical, are going to do really, really well.
Ergomed plc is a global leader in the provision of clinical trial and pharmacovigilance services, focused in particular on rare diseases and oncology. During the COVID-19 pandemic, we have been focused on two things. Firstly, providing support services to clinical research in COVID-19, both in Europe and the USA. And secondly, continuing to run our business, continuing to provide our services in clinical research and pharmacovigilance to ensure that these critical clinical operations continue in spite of the crisis. In terms of research, we have been involved in a number of studies, and I'll pick out two of them in particular. One of them was at the Pope John XXIII Hospital in one of the epicenters of the COVID-19 outbreak in Bergamo in Italy, where we have been working on a compound to delay the impact of COVID-19 symptoms on seriously ill patients. we, during the course of that study, from the initial startup, from the writing of the protocol to starting to dose patients, we recruited 50 patients over a 1-month period, and we started that up within 9 days, a process which typically would take 8 weeks. A similar research project was done at the Humanitas Research Hospital, and that was done in 2 centres in both Bergamo and in Milan. So we have been very heavily involved in specific studies targeting the symptoms of COVID-19. At the same time, we've continued to run our business, providing essential clinical research in areas like rare disease, oncology, and also ensuring that companies continue to comply with the mandatory regulatory pharmacovigilance requirements globally. And we have continued over the first half of the year to achieve our sales results, to deliver good financial results. We've maintained a steady course through the COVID-19 crisis. So those 2 things, contributing to research and continuing to deliver our services globally, have been the key focus and the achievements of Ergomed plc over the first half of 2020.
Netcall is a technology business. We have more than 600 organizations using our Liberty platform to manage and automate business processes and customer communications and engagement. The customer base includes more than 75% of NHS trusts. We have more than 20% of local authorities, our customers, and also several hundred private sector customers, including organizations like Lloyds, Nationwide, ITV, and many more. As the pandemic hit, we quickly adapted our technology roadmap to cater for new requirements related to the COVID-19 pandemic. One of the ways we did that was to create small agile development teams that focus on specific requirements and were able to specify, develop solutions quickly, in many cases together with our customers. Some examples of that is, for instance, a COVID-19 test app for hospitals that enables them to quickly and automatically communicate with people that's been tested, deliver test results, and any other information that's required. We have an in-car queuing app for patients, again, that rather waiting inside the hospital, they can wait in their cars and be called in when it's safe to enter the hospitals. We have more than 10 apps on our App Store today. We have more on its way, and we'll continue to develop new apps as we understand the market better and better, and our customers have new requirements. It has been very beneficial and given a big boost in the demand from these sectors in our fourth quarter of the financial year, which is also the second quarter of the calendar year. And we see it as a fantastic opportunity going forward for our Liberty platform and for our business as organizations more and faster embrace digital transformation and digital technologies.
We have operations in the UK, in North America, and in Germany. Core businesses, we service fryers in commercial kitchens. We service bulk fats, oil and grease in drains. We stop grease going down and blocking the drains. We manage pump stations and we replace seals in restaurants. So our core business is commercial kitchens, and we service over 7,000 customers every single week. So obviously our core business is commercial kitchens, and they've struggled during the COVID crisis. And very early on, we thought, well, we're going to have to, at some stage this is going to be over, and we're going to have to help our customers come back from this. So we have to get the economy working again, and quickly. So we came up with a filter shield service. It's sanitize, protect, and monitor. We sanitize places, we fog, we kill the virus. We then protect. We lay down a bond to surfaces and set up a nano-molecular layer of pins which kill viruses all the time. So we have a 30-day protection for that. And then we monitor. We've teamed up with industry experts. We have cameras in there for monitoring temperatures, so people with fevers can't come into buildings. So sanitize, protect, and monitor. Currently have lots of customers doing it. So we have schools, offices, restaurants, warehouses. Just take schools, for example. We've all seen the news where teachers aren't that keen on coming back, parents, pupils, and other stakeholders. So it's really important that we protect people coming back from that, and they're seen to protect them, giving people the confidence to come back. That's what our program is designed to do. So I live in Florida, where we have our services out here too, and it's been open a bit longer here. Obviously, the virus is spreading a bit more, but really, with a study showing that where restaurants had put in place visible measures to protect customers and staff, they were coming back quicker and had 43% more revenue than those that weren't doing it. So it's important people do protect and are seen to be doing it. And I think ongoing long term, obviously, as the virus recedes at some stage, our customer base will come back fully. So our existing customers we expect to come back. But then we have the filter shield service now for long term. The protect side of it, which is a 30-day barrier, was designed originally to reduce absenteeism at work. So I come back to the UK often. Our offices in the winter, especially in Rugby, it's like a petri dish. There's bugs going around, there's flu in the winter, there's colds. This helps protect against that, and it can reduce absenteeism by 50%. So we expect this one particular service to continue for our customers for a long time into the future.